Today I'll just explain what we do. We are specialized for occlusal rebalancing. Dr. Deepak Gupta and Dr. Meenakshi Gupta. We are occlusal rebalancing specialist. So, which by default it treats TMD symptoms. Those who have it or those who do not have it, it is for prevention. So, unknown facial pain are treated by wide balancing. Some people have extraoral symptoms of TMDs. TMD is temporomandibular disorder. Whenever jaw goes into hit and slide, the jaw occlusal locks are damaged. Whenever there is no canine guided occlusion, means canine touches, just rest of them don't touch. Like this, there should be a gap between the posterior teeth on side movement, and there should be occlusal locks. Means the cusp and the fossa should be there, and they should be equally, forces should be equally distributed. So whenever there is a loss of canine guidance, so the jaw goes into, first there is a hit slide, so then the hit slide, one tooth wears off, then the canine tips wear off, and the jaw goes into hit slide. So some people have hit more wear and tear, some people have less wear and tear. Whenever the jaw goes into hit slide, the teeth become like this, some will become, some will wear from here, some will wear from here. Any tooth can wear, any damage can occur anywhere. So the people go for for treatment, for root canal, for crown, for implant loose, or some people have extraoral TMD symptoms like temporomandibular joint symptoms, which are unknown diagnosed phase. So 60% of the global population suffers from undiagnosed head, neck, ear, teeth, jaw muscle and pain associated with bite imbalance and temporomandibular disorders, which are undiagnosed. They keep going to doctors but they don't find a cause. For migraine, they get MRI done, they don't get a cause. They take medicine, and it is temporary, it's a symptomatic treatment. So some people have early morning migraine, or migraine, early morning headaches, vertigo, dizziness, ear buzzing, ear ringing, ear block, ear pain, which is undiagnosed. So it's known as tinnitus. And some people have air passing through, the feeling of air passing through the ear. Some people have clicking jaw joints. Some people have jaw muscle stiffness. Some people have neck stiffness. Some people have discomfort while combing hair. It can be anything. So TMD is one of the most common. 50 to 60% of the general population suffers. Mostly also happens after aligner treatment, because the jaw balancing is not done. Aligner does only alignment, and balancing is different. So bone teeth, if are aligned, they cause imbalance. So only non-bone teeth should be aligned. That is the main information I need to pass on to people, that only non-bone teeth should be aligned. Otherwise they will go, if they are partially bone, they should be restorative alignment. If they are fully bone, they should be only restorative phase. So in this case, what we do is we do jaw balancing. Whether it is bone teeth, whether it is non-bone teeth, or it is partially bone teeth, we do balancing. People come to us after alignment because they suffer with TMDs and lot of wear and tear of teeth. So we do only jaw balancing, occlusal rebalancing, which by itself treat TMD symptoms. How do we do what we do? So we see the occlusal scan and we find out which teeth are bone. In this case, we see this is bone, this is bone. Wherever you see yellow portion, it is bone. And we see the canine tips are flat, almost flat. They should be more tip like this. So whenever there is a canine tip flat, you consider that your jaw is in deviation, or that is in hit and slide. So and there are no cusps on this. They should be cusps from behind like this. That creates the occlusal lock. So whenever the cusps wear around, they go into hit and slide. So what, like in this is a lower one. This almost canine tip flat. They should be like this. So whenever there is a canine tip flat canine tip, the occlusal goes into hit and slide. There is no canine guided occlusion, and there are more interferences on the side. Whenever interference means whenever the jaw slides, all the teeth touch. Otherwise, they do not touch. From behind, there is a space here. So the wear and tear is less. Whenever there is a canine lock gone, the wear and tear will be more. Like this, some will wear, some will break. In this case, this is because we go to root canal. This is damaged. So anything happens. Now what we do, we identify the bone teeth and we rectify without grinding anything. In the upper, I'll show you. See, this is almost flat. There is there is enamel loss here. So the one example, this one patient comes for root canal of one tooth because that becomes hypersensitive. You cannot eat food with this. So because the enamel is gone. So we detect the occlusion imbalances and we treat them. What we did is simply we did this. We rebuild them. We rebuild the cusps. Wherever it is enamel loss, we rebuild them. How do we do? See, this is the original and we have rebuilt them from wherever it is a less. We have just built them with the composite without doing any root canal and distributed the pressure. So this is what we do. We do occlusal rebalancing, and on this only this tooth required root canal, so we did root canal for this because this was very sensitive. So patient came for this, but we, for protection or prevention of further wear and tear, we did balancing. In balancing, wherever a tooth required addition, we did balancing, just like a car balancing or alignment. We don't do alignment only, we do balancing also. So simply by getting some aligner treatment for alignment does not balance it. We have to ask them how do we balance them, because people get alignment done and if they suffer with lot of imbalances of teeth and the teeth go into wear and tear. So in the lower I'll show you, this is the original, this is the original, this is original. You can see this enamel loss, yellow means second layer exposed. So as the tooth wears down, they go into root canal. Prevention is how we just rebuild them. And if you see, I will show you what we did is this. We just rebuild them with a composite. Without grinding a single tooth, we just rebuild them. We have added on the composite, created the occlusal locks, distributed the pressure. So these are the occlusal pressure points where whichever was necessary, and these points were created by checking with the either with the P scan or with the if a dentist is more experienced, they can do with carbon papers also. I mean the blue marking papers. So what we did is this. The pay originally came with this state and we did rebuild. So how did we do? We just keep on adding wherever it is required. We just add and balance it. This is addition. This is original and this is addition. So if I show you from inside, it is very complex treatment, but it is for protection of further damage. So we just check the imbalances and we balance them. We add them from wherever it is required. Like in this case, this is added, and each tooth has come into contact. So 32 teeth or if the 20 teeth come together, they hit together, they don't slide. So the pressure is distributed. Otherwise, the wear and tear, because of wear and tear, one was touching, one was not touching, the teeth were wearing off. There was no canine guidance. And see, this is bone, so we have just added on from here, slightly added, and then occlusion is established. Not a single tooth root canal except for the one which was patient was complaining of pain. So this is the way we did addition. From here angle I'll show you. This is bone tooth canine and we have added on. So from all the points from the other side I'll show you. This is the canine and we have added on. So if I show you from here, this is the original.
Google on a rod or Google.
This is the original and this is the add-on. And every tooth is composite. You cannot, because this is polished so well, not a single tooth required root canal here. And see, this is the original and this is the final. From all composite. This is the way we can balance the occlusion. This is the original and this is, can you just make out here, and this is final. So this is what we do in occlusal rebalancing. So people, we are specialized for occlusal rebalancing, and by itself it treats TMD and unknown facial pain.